Your tongue could be what will tell what is happening with you. Did you know this? Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Nderitu, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at some of the things that your tongue feels about your health, and when your tongue can also show diseases that you are suffering from. So, how does a healthy tongue look like? Before we say that you have a problem, we need to know how does when your tongue is healthy, how does it look like? It is usually pink in color, and it has light whitish hue in between the tongue. Then there are small uneven papillae distributed throughout your tongue. It is usually moist and not excessively wet or dry. You do not have your mouth running with saliva, or you do not have difficulties moving your tongue in the mouth because of the lubrication from the saliva. And that is how a normal tongue and a normal mouth is supposed to be. Then you have no thick coating, you have no cracks, and no ulcers or swelling on your tongue. And then if you do a 10-second mirror look of your tongue, you will notice when things are abnormal. So your tongue also is also capable of a lot of movement. Usually the tongue is capable of five types of movement. You can stretch it out like that. You can also be able to roll it like that. You can also move it sideways on both sides, and you can also roll it in your mouth. When you find your tongue is larger than normal, a condition we call microglossia, it could be a sign of various diseases, either because of thyroid problems or excessive growth hormone, or even some autoimmune diseases. There are some people who can be able to push their tongue out and see they can be able to touch the tip of your nose. You can try it and find out. Some because of illness, and the others because of enlargement of their tongue. So what are some of the conditions that your tongue will feel? When you visit the health facility, you will see the doctor looking at your palms, looking at inside of your eyelids, and then also checking the color of your tongue, and also looking below. They will tell you to open your mouth, and they look below your tongue. So if you have deficiency in iron, you have anemia, your tongue will not be pink, it will be pale than usual, lighter than the normal pink color. This is because of deficiency of iron. So that is one sign that you are unwell. You are deficient in iron, and this will be supported by paleness of your palms or the your nail beds, and also your conjunctiva. So that is a sign of anemia. Then if you have a thick white coating over your tongue, this could be a sign of oral thrush. What causes oral thrush? This is a sign of a fungal infection, and it is common after antibiotics because you kill the normal flora in your mouth, and then fungus thrive. It can also be a sign of diabetes, and this could be, if you have this, then you need to have your sugar tested. It could also be a sign of weakened immunity, like for example in conditions like HIV, and also in some conditions like cancers, or if you are undergoing chemotherapy. Then if you use drugs that we call steroids, drugs like prednisone, drugs like dexamethasone, they can make you have that oral thrush. So if you have that, then you need to check, do you have those conditions: diabetes, cancer, HIV, and also the possibility of antibiotic use. Then you have a red smooth tongue, a condition we call glossitis. Your tongue is red and overly pink. This is usually a sign of vitamin B12 deficiency, or folate deficiency, or iron deficiency. So this is another sign that your tongue can tell about your health. This can cause excessive fatigue, brain fog, and nerve pain, especially if you have vitamin B12 deficiency. I've talked about vitamin B12 needs and uses in the body in one of the health talks, upcoming health talks. So you can check on it if you want to know more about the needs and uses of vitamin B12 in our body. So how do you treat deficiency of vitamin B12? It is usually common in people who are vegetarian, and it is high in diets that are rich in meat. It is common, is readily available in meat and also in some supplements. So you can be able to supplement your B12 levels from those sources. Then you can have a burning or a painful tongue, which is increased sensitivity of your tongue. This could be a sign of many hormonal shifts or allergies, or it could be sometimes a sign of neuropathy. Neuropathy is an increased sensitivity of your nerves, and it can be caused by multivitamin deficiency. I've talked about B12 being one of the major deficiencies that can cause neuropathies and sensitivity. Sensitivity to your tongue, and also sensitivity to your nerves, and you have tingling sensation on the extremities of your fingers and even your nails. And if this is more persistent, if you have a burning sensation over your tongue or pain, then and it is more than 2 weeks, then you need to see your health provider and find out what could be happening with your health. Then you have the black hairy tongue. This is a sign of keratin buildup. What would make this happen? Keratin is the dark discoloration that makes your skin dark, and it can also make your skin look dark. It could be a sign of bacterial overgrowth from your mouth, or a sign of fungal overgrowth in your mouth. This could be linked to behaviors like smoking, use of cat, that persistent chewing of those things, use of coffee, and also poor hygiene, and sometimes use of antibiotics. I have said antibiotics clear the normal flora in your mouth, and they encourage an overgrowth of fungus, and this can be detrimental to your oral health. So this is usually a reversible condition, and basically you need to maintain a good hygiene, and also change your habits. If you are taking excessive you are smoking a lot or chewing a lot of that, you need to stop doing that, and you need to maintain your oral hygiene. Later we will look at what we are going to do to take care of our tongue. Then you have the yellow tongue. Why does your tongue look yellowish? This could be a sign of liver or gallbladder, and that's why many times your doctor will look at your conjunctiva, tell you to look down, look at your eyes, and then he'll also tell you to push your tongue out and then lift it up. He wants to see the other side of your tongue. And if it is yellow tinged, this could be a sign of excessive bilirubin. If you have excessive bilirubin, you will see it. The tongue will be yellow. You have that yellowness in your conjunctiva. You may have a change of your urine to the same yellowish color, and also you have white stools. This could also be a sign of acid reflux, or even a dry mouth. So if you have this yellowness of the tongue, then you need to make sure that you are well hydrated, you have a good oral hygiene, and if you have jaundice, then that is yellow is coloring, then you need to do your liver function test. So that would be very important. Then if you have plaques or recurrent ulcers in your tongue, this could be a sign of an autoimmune disease. Many of the autoimmune diseases can present with sores in the mouth, like what we call the Aphthous ulcer. If you have conditions like lupus, if you have problems in your tongue, like conditions like called Sjogren's syndrome, where you have a clacking of the tongue, and your tongue is also hypersensitive and difficult to remove out, then you should be checked for that autoimmune disease. And then you have dryness of the mouth, and you may also have difficulty in tearing. So again, oral cancers can also prevent with plaques or recurrent ulcers. And you have any ulcer in your mouth, all a growth in your mouth, then you should be checked, and sometimes it should be biopsied to rule out cancer. So if your ulcer persists for more than 2 weeks, or you have a growth on your tongue, be checked so that you do not miss out early symptoms of cancer. Then you have a dry, pale tongue. This could be a sign of dehydration. It could be a sign of anemia. It is also common in chronic illnesses. If you have been sick for long, your mouth gets dry, and you may also have that hairy tongue and darkening of your tongue. It can also be a common sign in old people, sometimes because of poor hydration, or signs of poor oral hygiene. So it is important that you get to rehydrate and take adequate amount of water, so that you maintain your tongue health, and also get your HB levels. So how do you take care of your tongue? We have seen that your tongue could be a map of some of the conditions that you could be suffering with. So what are some of the tips that you need to take care of your tongue? It is important that, as I said, have a 10 seconds, just a look at your tongue and see how does it look like. Is it pale? Is it pink? Is it black? Does it have sauce? Is it cracked? Is it dry? So clean your tongue daily with a soft brush. As you brush your teeth, remember that your tongue is part of your mouth, and you should also brush it. Then eat adequate vitamins and the minerals, especially to avoid deficiency of iron, folate, and other multivitamins. And then ensure you have good hydration, maintaining adequate water supply. For adults, between 2 to 3 liters. For children, it depends on their weight, and you can calculate their body water needs based on their weight. Then avoid smoking and limit your alcohol and coffee intake. We have said that alcohol and the smoking can affect the color of your tongue, can also be a risk factor for cancer of the oral cavity, a very common cancer in the head and neck region because of smoking, and sometimes starts with as an ulcer in the mouth or a growth in your tongue. When you have this, you need to be checked, and you need to have it biopsied. So do not stay with an ulcer or a growth in your tongue which you do not know. The bad news is sometimes some of these growth, they might not be painful, and you may ignore it. In one of my previous videos, I've talked about sores in the mouth as a risk factor for cancer. You can have a look at it and get more information on how cancers can present with the oral cavity symptoms. Then schedule regular dental and medical reviews. Having your mouth checked, your tongue checked, and also your tongue checked could be a sign that it will help your doctor to make a diagnosis of a systemic disease that you could be suffering from. And it could be starting just by looking at your tongue. So check your tongue every morning, and if you notice anything unusual, talk to your health provider. Tag a friend and share this insight so that we know how to recognize condition we might be suffering from by just looking at our tongue. Subscribe for more life-giving health tips to the overall health YouTube channel. Thank you for watching. See you in the next video.